Hello, and thank you for joining us for today's WHO Live event. We're here with Dr. Etienne Krug. He is the director of the Department of the Social Determinants of Health for the World Health Organization, and we're marking World Cities Day, which is tomorrow on the 31st of October, and the theme is valuing communities and cities. So we're going to be talking a little bit about how to stay healthy in your cities, and especially during this time of the COVID-19 pandemic. Welcome, Etienne.
Thanks for having me, Jamie, and happy World Cities Day.
Thank you. And we're going to start off with some questions, and I'd like to remind our audience that they can ask questions by popping their question into the comment box. Whether you're watching on Twitter, LinkedIn, YouTube, you can just ask your question and we'll answer that live here today. So we'll start off with our first question, Etienne. What impact can the city that you live in have on your health? No matter where you live, of course, where the city that you live in has some kind of impact. What does the impact of the city you live in have on your health?
Well, the place we live in has a big impact on our health. And we know that the urban environment is becoming more and more important. By 2050, 2/3 of the world's population will be living in cities. And these cities are growing very quickly. So living in a city can be fun. It allows to all kinds of entertainment. It has advantages of being close proximity with schools, with health centers. So there's a lot of advantages, but there's also a lot of challenges coming with that. The traffic can be very congested, there can be air pollution, there can be challenges with housing because people are migrating very quickly towards urban environments, and all of that has an impact on our health. So yes, living in a city has a big impact on our health.
So a couple of things that you mentioned, like traffic and congestion and the proximity and the closeness of people. So what can people really do in cities to stay as healthy as possible? What are some things that people can do, that governments can do, that city authorities can do to help people stay as healthy as possible?
There's a lot that can be done, really. It's of course, when you create a city, the whole urban planning is extremely important to make sure that there is green space, to make sure that there is space for safe walking and cycling, to make sure that housing is planned in a proper way, that there is proximity between the different locations where people need to go to, between house and school and work and shop, etc. So the city leaders have huge responsibilities, but of course as individuals we also have responsibilities in taking it into our hands and making sure that we have healthy behavior in terms of exercise, in terms of smoking, in terms of all kind eating and behaving responsibly. For example, we can also shop locally. There's all kinds of things we can do as well, but city leaders are key in making sure that cities are healthy.
Thank you. And we have actually our first comment from Chris Constanti, and he's mentioning, what about villages? So tomorrow is World Cities Day, and we're celebrating that to mark the day, talking about communities, which villages are, of course, included. So the theme is really valuing our communities and our cities. Thank you to Chris, who's asked that question. And I want to pick up on a couple of things that you've talked about so far. For example, green spaces. And we have some great examples of cities and what they've done during the COVID-19 pandemic. For example, in Sierra Leone, Freetown, they've had emergency food packages introduced to help keep people healthy, eat nutritious meals, and they've also been gardening, making good use of those green spaces. What are some other examples of what cities have been doing during the pandemic to keep people healthy, to make sure that they're safe from the virus?
So the response to the pandemic is, of course, happening at all levels, and national governments are extremely important. But the city leaders also have played a key role. City leaders are very close in proximity with their population. They have easier ways of working across sectors and bringing the different parts of city government together, and therefore can have a quick impact on their population. So there's many examples of what cities have been doing, from rethinking transportation to promote more cycling in, for example, Lima or Bogota, to doing test centers for more marginalized populations. Yesterday I was in an event when we heard the deputy mayor of Kampala talk about how they have set up a vulnerability index in Kampala to identify more vulnerable populations or areas that needed more support. Some cities have thought more about the elderly. In Nantes, for example, in France, they've done a whole effort to locate the elderly, make sure the older people, to make sure that they have access to food and all the supplies they need. So there have been many interesting initiatives done by cities, which, by the way, we have been compiling in WHO, and because we believe a lot in the importance of learning from others and replicating the interesting and good examples. Of course, we haven't had the time to evaluate scientifically every initiative, but we have compiled a whole series of case studies that we're launching today of examples of what cities have been doing, with the main purpose to inspire others to do the same.
Thank you. And as Etienne mentions, if you'd like to see these features and case studies on how cities are keeping people healthy and safe, especially during the COVID-19 pandemic, you can visit who.int to learn more. And I'd encourage everyone at this point to, if you have any questions, please pop them into the box in the chat below in the comment box. We are streaming live across Twitter, LinkedIn, YouTube, and Facebook. Thank you for joining us. And if you're just joining, we're marking World Cities Day, which is tomorrow, the 31st of October. And we are here with Dr. Etienne Krug, who is the director of our Social Determinants of Health Department at the World Health Organization. So for our next question, how have cities, we've talked a little bit about how cities have protected people during the COVID-19 pandemic, and how are you staying safe and healthy, Etienne? I'd like to ask, in your city, how do you find that you can stay safe, especially during these strange times right now?
Well, of course, I think during the current pandemic, I'm doing the same as what many, many others are doing in terms of social distancing, washing hands, coughing in my elbow whenever needed. So these are, of course, the basic. But I think it's also important that we think about our mental health, and certainly I'm doing, and trying to cycle as much as I can, which is something I love to do, and of course whenever it's safe, walking as well. I think being outdoors certainly has helped me stay safe. I've picked up bird photography for anybody who's interested, which has been fantastic in terms of, focusing on something else once in a while, and also trying to support the local food production, the local markets, going to the local markets and try to buy the produce from here, which we're very fortunate to have very nice of here in Geneva.
And that's interesting that you mentioned the local produce. In Brest, France, we have one example where they actually did a map of local producers so people could get their food more locally and eat a more nutritious diet. And as we've been discussing, so many things affect your health living in cities, from the air pollution, from the air you breathe, from what you can do to be more physically active. And many cities are following up and thinking of innovative ways to protect their populations during COVID. If you're watching today, please let us know if what your city has done to help keep your community healthy, and what you've done as an individual to stay healthy and protected from the COVID-19 virus. So we're having some questions come in. This is from LinkedIn. How do urban slums fit into world cities today? And this question's just come in for us. So Etienne, how do urban slums fit into cities, and how can they also stay safe and healthy as possible?
Well, the issue of urban slums is extremely important and growing as we see migration from rural areas to cities where people hope to find employment and better finances. People are often obliged as a first step to live in slums, and sometimes it's a step that lasts forever. So we see urban slums growing all over the world, and they're probably the quickest part of growth in the cities. This comes with very poor housing, with very often indoor air pollution. It comes with challenges of access to water. It comes with challenges of violence in the family or in the area. It comes with challenges of poor public transportation. So slums come with all kinds of challenges. In addition, of course, with the current pandemic of very rapid spread due to the difficulties of living in lockdown in one small room with several children. So slums are extremely important to think of on this World Cities Day, and to think of how we can support them by improving access to water, education, access to health centers, etc.
Thank you. Thank you very much. And we've had quite a few questions come in. This is from someone watching on Facebook, David Menem. He's talking about Vienna as a city and hosting many different nationalities. It has many green spaces. So during lockdown, people had places to go and get exercise while at the same time being physically distanced. So for cities that maybe don't offer those opportunities, how can they be encouraged in those cities that don't have those facilities to stay physically active during this time?
Well, Vienna is a great example and a lovely city, of course, of a city where all of these things are possible. I think for those cities who are still expanding, it's important to think now in those phases of expansion about green space, about possibilities for children to play, about possibilities to walk and cycle safely, and about safe and reliable public transportations. For those who already exist, it's of course harder to reformat something that's already built, often with relatively narrow streets and with many things already set. But we've seen great examples of, I've mentioned, I think, Lima, Bogota, even here in Geneva, in Paris, in London, efforts to regain territory for bicycles, regain territory for walking, so that people can move around in more sustainable ways of transport that don't pollute and allow for this physical activity that's so important.
Very true. And we have some great examples from cities around the world who are closing streets and making them only accessible for bicycles. For example, Etienne mentioned in Bogota and many other cities in Lima as well. Cities are starting to change the way that they think and coming up with innovative ways to protect people from the virus, and a lot of these changes might be able to be carried over. Do you think that this is an opportunity for cities as well that are coming up with these solutions to the challenges that they're facing for COVID? How can this be carried over?
Of course, we're all talking about building back better and make sure that the world we will live in after COVID is going to be better than the one we had before. So yes, it's an opportunity to try out new things. It's an opportunity to regain some of the spaces that were lost to the car, for example, or that were lost to other issues, and to make sure that our cities improve and become more livable. I think it's important for our physical health just as much as for our mental health.
Thank you. And I know WHO has recently launched a book on how to integrate health in urban planning. So a lot of questions on, how can cities plan better the cities? What about older cities, and what can they do if the space is really already made? Then does it come down to individuals? What can they do to stay healthy? What can then the city leadership do to help them in older cities that are sort of already planned out and may not have much green space or may not have everything, all of the facilities that we've been discussing?
Yeah, that's a great point, and I think more and more we're realizing that health is much more than health centers and doctors and nurses. It is about so many other things, about the employment, the education, and about how we plan the environments that we live in, how we plan our cities. And it is true, some cities are already planned. So then what do we do? Well, with a little bit of effort and creativity, there's a lot of changes that can still be made. I'm from Brussels, Belgium, and I remember an uproar a few years ago when the whole city center of Brussels, which was 600, 700, 800 years old, suddenly became car-free. There was concerns about the economic impact, etc., and about how people would get to places. People love it. Even the shop owners love it now, because the whole way of living has changed, and the way of shopping has changed, and the way of selling things has changed, but for the good. And it's a lovely place to be now. And many cities, we see efforts in Paris, we see big efforts that happened in New York a few years ago when Michael Bloomberg was the mayor, to regain some of the lanes that forever had been given to cars and give them to bicycles. And why not? And people love it.
Yes, a lot of cities are doing this, opening bike sharing programs and making, even if the city's already planned, as we mentioned, creating gardens on rooftops, how innovative ways that people can get green space, get more fresh air. And especially during the pandemic, people have been coming up with interesting ways. There's a question on how the health sector can support an intersectoral approach to protect and promote people's health. So what can the ministries of health do, the city leadership? What can they do, and who should they be working with to bring it all together?
Yeah, that's another great point. And I think the starting point is, again, not to think that health belongs to the ministries of health or the leaders of health or to the doctors. No, health is an issue for everybody. If you are in charge of urban planning, if you are in charge of transportation, if you are in charge of employment ministries, if you are in charge of education, it has so much to do with health. The way people move around, the way people get educated, the way people get to work, where we all live, and how this living is planned, it has a huge impact on our health. If we can move around safely and healthily in a sustainable way, if we can work in a safe environment, if we can live in safe housing, it makes a huge difference on our mental health, on the rates of cancers, on the rate of spread of COVID-19. All of it is depending on all of these factors. So it's not only about doctors and nurses, it's about the whole of society and all of the different sectors.
Thank you. And you've mentioned mental health and how important that has been, especially during the pandemic. It's important to stay connected to people as much as you can. And we have one example from Limerick, Ireland, where they created a team of 1,700 volunteers who actually helped bring groceries, medicines to the elderly community, and ensured that while they might have been at higher risk for COVID-19, they were also seeing people and getting the important and essential services that they needed. We have many examples. If you're just joining us, we're talking about what cities can do during the COVID-19 pandemic and to stay healthy and keep people healthy. I'd encourage everyone watching, if you have any questions, please pop them in the chat box below. We're here to mark World Cities Day, and the theme this year is valuing communities and cities. And as Etienne mentioned, over 50% of the world's population is now living in cities. So it's very important how the city's set up and how people can stay healthy in cities, especially because we're in much closer proximity to each other. There's maybe less green space. So what are some of the things that individuals can really do in cities to stay healthy? And we do have a question also coming in. What kind of guidance do people need to be in a good situation and to stay healthy? This is from Ahmed Sharaf on Facebook from Bangladesh. Thank you for asking your question. So what guidance do people need, and how can they stay healthy as individuals?
Well, I think on one hand, we need to make it easier for people, and this is a message to the leaders of cities, of countries, make it easier for people to live in a healthy way, and that's the way we plan our cities, the way we plan our transportation, promoting, walking and cycling and safe public transportation, the way we plan our workplaces, etc. On the other side, of course, the individuals need to take advantage of all of that. First of all, individuals need to claim and demand and make sure that those who are elected will do the right things for health. But then also in our own behavior, make sure, particularly in these times of COVID-19, that we take the time to move, to exercise, to do some kind of activity that brings our heart rate up and will be healthy, while at the same time also thinking about our distractions and trying to think about our mental health and relaxation. And finally, we as adults, need to think about our children and make sure they are not glued on screens all the time during lockdown, but have an opportunity also to get out a little bit, to play, so I think this whole aspect of parenting is also extremely important, to make sure that we spend at least 20 minutes a day with our children in order to promote their physical and mental health, and in order to avoid stress and unnecessary tensions and sometimes violence in the family.
Absolutely. So there's a lot that individuals can actually do to make their cities healthier and safer. We yesterday had a great conversation with mayors from around the world where they discussed a social contract and the idea of having people actually doing something for the greater good and the greater health of the community. So what do you think about that concept of the social contract, and what role do individuals have in policy making and supporting governments to make those right choices?
I think people have a big role, first of all, in the decision on who they elect as their leaders, but also in supporting that there are so many organizations, civil society organizations that promote either physical activity or green space or mental health or support to the most vulnerable groups, older people, people with disabilities, single household families. So I think supporting civil society, actively being part of it or supporting it financially are certainly things we can all do as individuals. And again, I think, first of all, starting with ourselves and our own families and our own children. And again, serving as good role models for our children, as good parents, and is extremely important.
Yes, absolutely. There's so much that individuals can do. And as Etienne mentioned, actually calling for change, calling for action within your community if you feel there are things that could be healthier, safer, to keep the community in good health and well-being. So I think it's an important role that individuals play, as you mentioned. And we have one example. We talked about clean air from pollution, and that people can ride bicycles more or do more walking in cities. So another example in terms of clean air and breathing fresh air, in Ahmedabad in India, they banned smokeless tobacco to help prevent the spread of COVID-19. And many cities are becoming aware that tobacco and smoking actually create more of a risk for a severe case of COVID. So that's another thing that individuals might be able to do, is to not be smoking. And in this city, they actually found a way to ban smokeless tobacco. So that's one example from Ahmedabad, India. If you have examples from your cities of how the cities are staying safe and healthy, please pop them in the chat and share with us. We'd be happy to mention them, as well as answer your questions on how you're staying safe or how people can stay safe. Today we're talking about cities, healthy cities, and especially during the COVID-19 pandemic, how people can stay healthy in cities that they live in. So tomorrow is World Cities Day, the 31st of October. If you're just joining us, please make a comment or a question in the chat box below and interact with us today. We'll answer those questions live. I'm here with Dr. Etienne Krug, who is the Director for the Social Determinants of Health Department at the World Health Organization. And Etienne, we have a few more questions coming in. Yes, people are asking about COVID-19 and different measures being taken. We have one example we've talked about earlier in Buenos Aires. They actually set up checkpoints where people can measure temperatures, which is one risk factor if you have a higher temperature in those communities. Are there other ways that people can, we talked about physical activity and what people can do. So if some cities are in lockdowns, how can you stay safe and healthy in your own home?
It's not easy. I think we have to recognize it, that it's a challenge, to be locked up, often in a relatively small apartment, having to telework while there's 2 or 3 children running around and in need of attention and need of education. So I think, first of all, we have to recognize that it's a challenge, and it requires some effort and some creativity. So I think, making sure we set some time aside to get outside with our children, if possible, to ensure some play, making sure we structure the day so that there is time for work, there is time for play, there is time for relaxation. Try to eat healthily, try to avoid alcohol consumption and drugs, of course, tobacco smoke we talked about. I think it's clear that consequences of COVID are worse when there are pre-existing conditions, when people are exposed to particular risk factors for non-communicable diseases, such as tobacco, such as alcohol, such as unhealthy diet. So trying to avoid falling into that trap because of frustration and lockdown is important in order to also prevent the disease. And of course, the very classical measures of washing our hands, social distancing will remain important. Wearing of masks will remain important all along. But it's hard. We know it's hard, and we have to recognize that.
Absolutely. And we had some great examples from people coming in the chat. For example, people say they've been running up and down the stairs in their apartment building to try and stay physically active. Other people are helping deliver food to elderly neighbors to make sure that they have local produce. Some great examples. Thanks for adding this in the chat. And we at WHO actually have many cities that have joined Healthy Cities networks. So we have the Partnership for Healthy Cities, which was previously focused on non-communicable diseases. We have, of course, the Age-Friendly Cities, that is a network keeping elderly people more active and healthy and involved in the community. And we also have the Breathe Life network to decrease air pollution as well. So many cities are really excited about becoming healthier. Many of them are now switched over to COVID-19 and ensuring that their populations are safe and healthy and protected from the virus as well. But they continue to work on topics like food security, aging, marginalized populations, transport and mobility. And WHO has released a series of cities who are taking incredible actions to ensure the health of their people, especially during the COVID-19 pandemic. And if you'd like to see those, you can visit who.int for more information. Some examples we have are from Freetown, Sierra Leone, Milan, Italy, Brest, France. We have a few from Lethbridge, Canada, Limerick, Ireland, Nantes, France, Athens, Greece. We were joined yesterday in a discussion with the mayor of Athens on how he's protecting more vulnerable communities in Greece, as well as the mayor of Buenos Aires in Argentina. They're improving support measures for informal settlements, as well as providing food, health services, and access to many kinds of essential services in Buenos Aires. Examples from Kampala, Uganda, Baku, Azerbaijan, Bogota, Colombia, Lima, Peru, Moscow, Russia, just to name a few. And I'd like to thank everybody here for joining us today. We've been talking about how you can stay safe and healthy in your city, and talking about healthy cities in general. And especially right now during the COVID-19 pandemic. So thank you for joining us. And I'd ask if you have any last questions to pop them into the chat. We're here today with Dr. Etienne Krug, who is the Director of Social Determinants of Health at the World Health Organization, discussing how you can stay safe and healthy in cities to mark World Cities Day, which is tomorrow, the 31st of October. And our colleagues at UN Habitat have named the theme this year, Valuing Communities and Cities. And that's especially important right now when 50% of the world's population is living in cities and people are trying to stay safe and protected from the COVID-19 virus. So I'm going to go now to some last questions. Etienne, what plan do you have for the, well, I guess in WHO, what plan do we have for cities that have industrial areas in the cities, or what advice do you give for more industrialized cities on what they can do to have healthier cities?
Well, of course, I mean, this is a very important topic it concerns, I think, the vast majority of cities where there are industrial areas. So the issue of pollution is, of course, extremely important. Pollution of the air, pollution of water. So thinking about all the necessary prevention measures there, making sure there is the right legislation, enforcement, and of that is important on one side. But also thinking about workers' health in all of these environments. This is critically important. And then, you know, you have the measures for all cities also apply to those areas, making sure there is still green space, there is still possibilities for walking and cycling safely, there is safe public transport to and from these places. So the classical, I'd say, urban planning measures are also important for those ones.
Absolutely. Thank you very much for that. And I'm going now to those in our audience who have been asking about more on physical activity and things that they're doing, comments being made. People are lifting food cans so they can keep their muscles strengthening up, which is a very creative and innovative way. Many of the cities in our cities networks have also been coming up with some great ways to keep their populations safe and healthy. Can you give us one more example of a city that's working to keep their populations safe and healthy during the COVID-19 pandemic?
Yeah, well, there's many examples. One we haven't talked about yet is Moscow, for example, who has worked a lot on the public transport system and trying to make sure that it functions well, but also is safe in this time of COVID-19 and is expanded in a city where we know traffic jams are quite notorious. And then, you know, since we are here in Geneva, I'd like to take my hat off to Geneva as well, which has done a major revolution in the favor of the bicycling and walking in the last few months, against sometimes tough protests on one hand against this measure, but also with a lot of support from other parts of the population. And I think gradually people will come along and see the advantages of taking these decisions, which initially change is always a bit unsettling, and new ways of living and moving around have to be found. But once it's in place, it's beneficial for all.
Thank you, Etienne. And on that note, what would be your advice on cities to continue to build back better, not just right now during the pandemic, but afterwards as well? What can cities do to ensure that they keep some of these new solutions, that they continue to build back better and have healthier communities?
Well, of course, it's going to be challenging because we are in a financial crisis on top of this very difficult pandemic, but it is an opportunity to rethink how things are working, and not every change is an expensive change. So I'd like to invite all city leaders around the world to come to the WHO website and look at the case studies that are there, because the main purpose of these case studies that we're launching today is to inspire leaders around the world. There's no need to reinvent the wheel every time. We can just learn from each other, learn from successful examples and replicate them.
Thank you. And thank you for everyone who's joined us today to discuss healthy cities. We're marking World Cities Day on the 31st of October. We'd like to also, I have one. Okay, thank you for all of your questions, and I'd also say if there are ways that you're staying safe and healthy in your city, please pop them in the comments box and continue to ask your questions. It's been a pleasure to be here with you today. Dr. Etienne Krug, the Director of the Social Determinants of Health Department from WHO, thank you for joining us.
Thank you.